Hello everybody and welcome to the Tuesday edition of Video Clips, and I'll just start with a couple of announcements. Summer semester is just 3 weeks away. I can't believe how much the time is flying by, right? We're offering the Diet and Lifestyle Intervention course with the celebrity instructors, Dr. Esselstyn, Dr. Barnard, Dr. Goldhammer, Dr. Ralph Moss, Dr. Schultz, me, Janice Stanger. Amazing program. It's Wednesday night. You don't want to miss this. You'll be so sorry you did when you hear all the cool stuff everybody learns. So anyway, we're offering that. I'm also doing a meal planning course that might interest you on Monday nights and this is all done through teleconference. You can be any place on the planet. We have students in Asia, Australia, all over Europe, Scandinavia, all over North America, so you can be any place and do this. But the meal planning class is going to be how to help people change their eating habits when they have all kinds of conditions ranging from economic limitations to religious observation to kidney failure, genetic diseases like cystic fibrosis, etc. So anyway, that's coming up, and then some of you know we now video stream from here, and on June 6th is our next dinner. So I can't feed you from here, but what you can do is participate in the discussion, listen to the presentation that I make and the Q&A, and you can ask questions. They pass them to me, I repeat them, and you can get your question answered regardless of where on the planet you are. All right, so let's get to the news. According to an article in the British Medical Journal, medical error is the third leading cause of death in the United States after heart disease and cancer. At this time, we spend a lot of money, and we should, on researching heart disease and cancer, but medical error doesn't appear on the top 10 list of the CDC, so little research is invested, or funds or resources are invested in trying to prevent it. The authors note that the findings should promote a lot more interest in directing research dollars in that direction. Now, this is not new information. Many experts, Colin Campbell being one of them, wrote about in his book Whole that medical error is a leading cause of death. Shannon Brownlee, in her book Overtreated, writes about it. And a lot of people have criticized the Centers for Disease Control for not including it on the list. Now, one of the reasons for the omission is that death certificates, which are used for ranking the cause of death and for setting public health priorities, don't contain information about medical errors. In fact, what's used for death certificates is the International Classification of Disease Codes, and medical error is not an option. The system is really not right for this purpose because it was designed to help physicians bill for services, not as a way to collect data that would guide public health and public policy decisions. Medical error, just so we know what we're talking about here, is an unintended act of either omission or commission, treatment that does not achieve its intended outcome, the failure of a planned action to be completed as intended, or the use of an incorrect plan for achieving a stated goal. Now, what the researchers did, who published the article in the BMJ, they looked at data from 4 studies that analyzed medical death rates and hospital admissions from 2013. They determined that for that year, 9.5% of all deaths in the hospital, or over 251,000 of them, were due to medical error. Now, for many years, this is a bigger number than has been reported. Previously, the number that was used came from the Institute of Medicine, which issued a report, and the incidence in that report was considerably lower. They looked at or listed the range as between 44,000 and 98,000 deaths per year. The report was highly criticized because, first of all, it did not involve any original research on behalf of the IOM, and because analyses from other organizations continued to show that the rate was actually much higher. And we're talking about organizations like the Agency for Healthcare Quality and Research and the U.S. Department of Health and Human Services. Some claim that even this recent report is too low and the number's closer to 400,000. James Rickard, medical doctor, agrees. He says that many errors take place in doctors' offices and outpatient centers, and this data only comes from errors in the hospital. And some claim that the problem is even greater because the study, again, limited to hospital. He says, I think most people underestimate the risk of error when they seek medical care. And I think that that's very true. I'll come back to that in just a little bit here. The authors suggest several strategies for improving the situation, which include making errors more visible and discussing them openly. They say that discussions about medical errors often take place in private meetings behind closed doors in order to avoid anybody drawing attention to them and the public knowing about them. And they also suggest that the death certificates themselves should be changed to allow for a category that includes the potential for errors in the patient's care to have caused the death. Hospitals should conduct internal investigations of death in their facilities to identify those cases in which error was a factor. And if these things were done, and this type of data was collected, and the problem was assessed and that sort of thing, then strategies could be developed that would actually change the situation. And that's in fact what the airline industry has done for years. When accidents happen, you might remember if you've watched news reports, there's a rush to find that black box, to analyze everything that happened, and this diligence in facing the issue is one of the things that has made airline travel actually remarkably safe, and safer now than it ever was. Dr. Rickert says he's all for this stuff. He says public pressure is going to be needed to force hospitals to change their ways. In the meantime, some words of advice. I think this information underscores the need for consumers to be educated so they can make informed choices. As Dr. Rickert says, most people don't think much about risk when interacting with the medical system. But there are risks, even when you just visit a doctor's office for an annual appointment. The danger is greater in a hospital setting due to the compromised health of the patients, the hospital environment, the risk of infection is high, the health-destroying meals that are served, and the fact that hospitalization just involves more drugs and procedures, which is more opportunity for something to go wrong. Hospitalized patients, I've said this for years, should have an advocate. It may take 2 or 3 for an extended stay, and these advocates should be looking at tests and medications and medication interactions, and if possible, bring in health-promoting meals from outside the hospital. It's often said that hospitals are terrible places for sick people, and that I think people in these institutions need somebody to look out for them. So even at 250,000 people in the hospital, it's too many. If we take into consideration errors outside, gosh, it might be bigger than heart disease and cancer combined. All right, so on to the next topic. Thankfully, an increasing number of teenagers with depression are refusing to take drugs. Both kids and their parents are more aware than ever of the side effects, which include increased risk of suicide and violence. This is a good thing, and we can thank the internet for this, since the mainstream media seems to be intent on focusing on the biological model of psychiatry, and they do it in a couple of ways. One, by featuring significant millions, tens of millions of dollars worth of advertising, ads placed every year in magazines and on television, advertising the benefits of these drugs. And then also when violent episodes like Sandy Hook and Columbine happen, there's no shortage of experts on hand that talk to traditional media sources and warn everybody that we need to do more early intervention and get these people under the care of expert psychologists before they do something violent. Well, the problem is that almost all these acts of violence are committed by people who are already under the care of a psychiatrist and already taking the drugs. So my point in all of this is teens who refuse to take medications and seek other options are actually quite wise. Cognitive therapy has been proven to help depressed people without the use of drugs and with a very low rate of recidivism. CBT is very effective for both adults and children, and a new study shows that it works really well for teens too. One of the ways in which cognitive therapy works is that it teaches people how to identify unhealthy and depressed thoughts and replace them with realistic, accurate, and more positive thoughts. So in this study, researchers at the Kaiser Permanente Center for Health Research randomly assigned 212 teens between the ages of 12 and 18 with major depression to weekly cognitive behavioral therapy or usual care, and that usual care was stuff like a regular therapist or school counseling. All of the teenagers had either refused to take antidepressants or had already withdrawn from them at the time that the study began. The researchers noted that the results of the study were consistent with meta-analyses showing that CBT is effective for youth depression, and may be effective for reducing the risk of future depressive episodes in teens. So early diagnosis and treatment with therapy doesn't hurt kids. Early diagnosis and treatment with drugs hurts everybody who's put through that program. Almost all children and adolescents who have psychological issues improve with good therapy. This study showed not only that CBT was effective, but that it was more effective than the usual care, school counseling, traditional therapy that people get. I'm convinced that the reason why CBT is not more prevalent is because it's not presented as a better alternative in educational programs for mental health professionals, and also because it's just plain bad for the mental health business. Therapists and counselors benefit financially when people stay in therapy for years, not weeks. The longer a patient remains in therapy, the more revenue they generate. And psychiatrists love the biological model of mental health with short visits and prescriptions for drugs to treat the mental illnesses they diagnose. I think CBT should be the first option for addressing mental health issues for both children and adults, and drugs should absolutely be reserved when there is no other choice. Now, my gosh, the drug companies wouldn't be making billions every year on these drugs if they were used that way, but that would be the responsible thing to do. All right, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I will be back to you on Thursday with more news.